Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. How are critical thinking skills and critical thinking attitudes similar? Both are. Option A. Influences on the nurse's problem solving and decision making. Option B. Like feelings rather than cognitive activities. Option C. Cognitive activities rather than feelings. Option D. Applicable in all aspects of a person's life. Right answer is Option A. Influences on the nurse's problem solving and decision making. Cognitive skills are used in complex thinking processes, such as problem solving and decision making. Critical thinking attitudes determine how a person uses her cognitive skills. Critical thinking attitudes are traits of the mind, such as independent thinking, intellectual curiosity, intellectual humility, and fair-mindedness, to name a few. Which organization's standards require that all patients be assessed specifically for pain? Option A. American Nurses Association, ANA. Option B. State Nurse Practice Acts. Option C. National Council of State Boards of Nursing, NCSBN. Option D. The Joint Commission. Right answer is Option D. The Joint Commission. The Joint Commission has developed assessment standards, including that all clients be assessed for pain. The ANA has developed standards for clinical practice, including those for assessment, but not specifically for pain. State Nurse Practice Acts regulate nursing practice in individual states. The NCSBN asserts that the scope of nursing includes a comprehensive assessment but does not specifically include pain. Which of the following is an example of data that should be validated? Option A. The urinalysis report indicates there are white blood cells in the urine. Option B. The client states she feels feverish. You measure the oral temperature at 98 degrees Fahrenheit. Option C. The client has clear breath sounds. You count a respiratory rate of 18. Option D. The chest X-ray report indicates the client has pneumonia in the right lower lobe. Right answer is Option B. The client states she feels feverish. You measure the oral temperature at 98 degrees Fahrenheit. Validation should be done when subjective and objective data do not make sense. For instance, it is inconsistent data when the patient feels feverish and you obtain a normal temperature. The other distractors do not offer conflicting data. Validation is not usually necessary for laboratory test results. Which of the following is an example of appropriate behavior when conducting a client interview? Option A. Recording all the information on the agency-approved form during the interview. Option B. Asking the client, why did you think it was necessary to seek healthcare at this time? Option C. Using precise medical terminology when asking the client questions. Option D. Sitting, facing the client in a chair at the client's bedside, using active listening. Right answer is Option D. Sitting, facing the client in a chair at the client's bedside, using active listening. Active listening should be used during an interview. The nurse should face the patient, have relaxed posture, and keep eye contact. Asking why may make the client defensive. Note-taking interferes with eye contact. The client may not understand medical terminology or healthcare jargon. The nurse wishes to identify nursing diagnoses for a patient. She can best do this by using a data collection form organized according to select all that apply. Option A. A body systems model. Option B. A head-to-toe framework. Option C. Maslow's hierarchy of needs. Option D. Gordon's functional health patterns. Right answer is Option C. Maslow's hierarchy of needs. Nursing models produce a holistic database that is useful in identifying nursing rather than medical diagnoses. Body systems and head-to-toe are not nursing models, and they are not holistic. They focus on identifying physiological needs or disease. Maslow's hierarchy is not a nursing model, but it is holistic, so it is acceptable for identifying nursing diagnoses. Gordon's functional health patterns are a nursing model. The nurse is recording assessment data. She writes, "The patient seems worried about his surgery. Other than that, he had a good night." Which errors did the nurse make? Select all that apply. Option A. Used a vague generality. Option B. Did not use the patient's exact words. Option C. Used a waffle word, for example, appears. Option D. Recorded an inference rather than a cue. Right answer is Option D. Recorded an inference rather than a cue. The nurse recorded a vague generality. He has had a good night. The nurse did not use the patient's exact words, but she did not quote the patient at all, so that is not one of her errors. The nurse used the waffle word, seems worried, instead of documenting what the patient said or did to lead her to that conclusion. The nurse recorded these inferences, worried and had a good night. A patient is admitted with shortness of breath, so the nurse immediately listens to his breath sounds. Which type of assessment is the nurse performing? Option A. Ongoing assessment. Option B. Comprehensive physical assessment. Option C. Focused physical assessment. Option D. Psychosocial assessment. Right answer is Option C. Focused physical assessment. The nurse is performing a focused physical assessment, which is done to obtain data about an identified problem, in this case shortness of breath. An ongoing assessment is performed as needed, after the initial data are collected, preferably with each patient contact. A comprehensive physical assessment includes an interview and a complete examination of each body system. The nurse is assessing vital signs for a patient just admitted to the hospital. Ideally, and if there are no contraindications, how should the nurse position the patient for this portion of the admission assessment? Option A. Sitting upright. Option B. Lying flat on the back with knees flexed. Option C. Lying flat on the back with arms and legs fully extended. Option D. Side lying with the knees flexed. Right answer is Option A. Sitting upright. If the patient is able, the nurse should have the patient sit upright to obtain vital signs in order to allow the nurse to easily access the anterior and posterior chest for auscultation of heart and breath sounds. It allows for full lung expansion and is the preferred position for measuring blood pressure. Additionally, patients might be more comfortable and feel less vulnerable when sitting upright, rather than lying down on the back, and can have direct eye contact with the examiner. For all body systems except the abdomen, what is the preferred order for the nurse to perform the following examination techniques? A. Palpation B. Auscultation C. Inspection D. Percussion. Option A. D. B. A. C. Option B. C. A. D. B. Option C. B. C. D. A. Option D. A. B. C. D. Right answer is Option B. C. A. D. B. Inspection begins immediately as the nurse meets the patient, as she observes the patient's appearance and behavior. Observational data are not intrusive to the patient. When performing assessment techniques involving physical touch, the behavior, posture, demeanor, and responses might be altered. Palpation, percussion, and auscultation should be performed in that order, except when performing an abdominal assessment. The nurse is assessing a patient admitted to the hospital with rectal bleeding. The patient had a hip replacement 2 weeks ago. Which position should the nurse avoid when examining this patient's rectal area? Option A. AIIMS. Option B. Supine. Option C. Dorsal recumbent. Option D. Semifowlers. Right answer is Option A. SIMS. SIMS position is typically used to examine the rectal area. However, the position should be avoided if the patient has undergone hip replacement surgery. The patient with a hip replacement can assume the supine, dorsal recumbent, or semi-fowler's positions without causing harm to the joint. Supine position is lying on the back facing upward. The patient in dorsal recumbent is on his back with knees flexed and soles of feet flat on the bed. In semi-fowler's position, the patient is supine with the head of the bed elevated and legs slightly elevated. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.